G'day, I'm Ted Jedinak, International Educator and Podiatrist, helping health practitioners master new treatment skills so you can get better clinical outcomes. Yesterday, I received a great question about ankles, metatarsals, and hallux valgus. Oh, sounding pretty juicy, huh? In fact, there were 3 great questions. They came from Aaron Wicks, who graduated from his foot mobilisation training last year. Aaron is a podiatrist who hails from Townsville in Queensland, Australia. He's a really proactive practitioner and a great inspiration to me. So Aaron posted on the FMT Society of Soul Savers on Facebook. It's a place where graduates of our foot mobilisation workshops can ask questions, seek advice and chat with each other about some cases. These are the questions Aaron posed. Hello fellow FMTers, just wondering when you're dealing with HAV, how much of the intermetatarsal angle and hallux valgus angle is considered too severe to correct with FMT? With the tool-assisted massage, what tissues are we targeting for HAV correction? And with chronic ankle pain, ankle instability, do people usually refer for MRI to check for osteochondral lesions, meniscal bodies, ankle synovitis before undertaking the protocol? Would an osteochondral lesion be a contraindication? Thanks for your questions, Aaron. Great to have sought clarification so you can deliver the highest quality service to your patients. To help you, the viewer, be very clear on each of Aaron's questions, I've shot 3 separate videos answering each question individually. I thought that if Aaron has these questions, it's highly likely that other practitioners are also wondering the same thing. This video will answer question number 1, and then there'll be separate posts for the 2nd and 3rd questions. So let's rock into it. Question number 1, how much intermetatarsal and HAV angle is too great to correct? Just so that you, the viewer, is in the loop of what Aaron's referring to, the intermetatarsal angle is the angle between the 1st and 2nd metatarsals, which you can see here with this image. The HAV angle is the angle between the 1st metatarsal and the proximal phalanx, which you can see here in this image. Now, Aaron's asking if there's a point where the angle is so great that conservative treatment with manual therapies is not worth doing. Okay, Aaron. The angle is never too great to treat with FMT. In other words, FMT can be highly effective no matter what the HAV angle is. I'll show you a case study a little later to prove the point. Even with extreme joint displacement and chronic connective tissue adaptations, all you have to do is achieve as little as 10% increase in joint mobility. And this alone will make a measurable difference to the synovial fluid production in the joint. This means just by getting a little more movement in the affected joints by utilising foot mobilisation, nature's lubricant, synovial fluid, will increase. And this can make a world of difference to someone who has dried up, stuck joints, even if their joints are extremely displaced. Now, another question you might also be thinking is, how much correction can be achieved with extreme joint displacement? This varies wildly depending on the individual's history and clinical presentation, but have a look at this example here that I'm showing, and this is pretty extreme. You can see a very high AD duction of the 1st metatarsal and very high AB duction of the hallux. And now you can see the post-treatment corrections achieved through manual therapies. This is an example of how much correction can be achieved through FMT and manual therapies, but not every case will respond to this degree. So when you've a case of high joint displacement, Ted's tip is this: communicate openly to your patient in this way. These are the exact words that I use. Mary, in theory, you should be able to achieve some correction. The truth is, I can't predict how much change will happen, so I suggest we work together for 6 weeks and then reassess how we're doing. I'd even tell them that they should consider this treatment as a trial, which in fact is the truth. Remember, you're probably dealing with a patient that's had the problem for decades, so 6 weeks is a relatively short space of time. It's enough time to work with Mother Nature to stimulate cellular changes in the collagenous tissues around the joint. And really, what other options do they have? Surgery? Look, as a non-surgical option, you can't beat FMT and tool-assisted massage. I hope that's helped your thinking and decision making, Aaron. The next clip will answer which tissues you're going to target with your tool-assisted massage. Until then, serve with spirit, consult with care, and help more halluxes today.